All right, we'll go ahead and get started. Seems like people are still kind of logging in, so let them get logged in, but we'll go ahead and start our presentation. So my name's Samantha. I'm going to go ahead and switch to the presentation so everyone can view that. All right, first I want to welcome everyone to our first session in our 2025 webinar series. We will be discussing what is functional health. Everyone is automatically muted and has their cameras turned off. Please feel free to utilize the chat box if you need something. We will have a Q&A session at the end, so please feel free to submit your questions throughout the webinar using the Q&A option at the bottom of your screen. Any unanswered questions will be addressed in a follow-up email. We will also be sending out a follow-up email with a recording of this session for anyone that's registered, so you can rewatch at your convenience, or if you need to watch later if you need to hop off for any reason. So I am Samantha Hart. I'm the nurse practitioner over the functional health program at IV Nutrition. I officially started with the company in November 2024, but I have been learning in the background about the company and about functional health as a client and provider over the last 5 years. My primary role is providing lab reviews and recommendations utilizing the services IV Nutrition offers. I also am working on expanding my role to include providing education to our staff and clients. These webinars are one avenue in which I'm doing this. My monthly webinars are intended to be helpful for clients, but to also keep our staff well informed. I hope to really address topics that people that are brand new to functional health and IV nutrition may have, but also provide some new information for some of our seasoned clients and team members. My background prior to starting with IV nutrition was primarily working in the hospital setting and with acutely ill patients. But over the last 2 to 3 years, I really focused on expanding my knowledge to include learning more about functional health. I was growing frustrated with some of the limitation of conventional medicine, such as like insurance coverage issues, limited time to talk to patients, and always not getting to understand the why behind certain recommendations and treatment plans. I felt strongly I wanted to be able to support my patients in making informed decisions and also help them advocate for themselves. I wanted to help people learn about preventative options before they went down the pathway of being diagnosed with chronic diseases and stuck on medications long term. I truly love educating my patients and want them to feel comfortable with their health decisions. I think the biggest draw for me was just learning how amazing our body is and how it is already equipped to do so much and try to regulate and balance everything on its own. But through life, we're constantly exposed to different stressors that make it difficult for our body to maintain that balance. This is kind of what led me to IV nutrition. So now I'm here to help educate our clients and our staff so everyone can understand why we're here and why we do what we do. So the question, what is functional medicine? You'll probably hear the term functional health and functional medicine used interchangeably throughout this. Functional medicine is an evolution of healthcare practice, but it's also in some ways just going back to the basics. By shifting from disease-centered focus of conventional medicine to a more patient-centered approach, functional medicine allows the whole person to be addressed, not just a set of symptoms. Functional medicine providers often focus on their client's history, genetic predisposition, environment, and lifestyle to try to find connections that may have contributed to the development of health issues and chronic diseases. The goal is to really support each person in an individualized way. So why functional health? Functional health and medicine really come into play when we're looking at supporting the body and doing what it was designed to do and helping prevent ongoing damage to our body. We try to focus on the root cause of why you have developed a symptom or a chronic illness, rather than prescribing a medication that just covers up the symptom. We use natural vitamins, herbs, and minerals that your body easily recognizes and can readily absorb and help support what your body was designed to do. We're seeing more and more people being diagnosed with autoimmune disease, infertility issues, mental health illnesses, heart disease, diabetes, cancer, all sorts of chronic diseases. Conventional medicine focuses so strongly on acute care, which is more the diagnosis and treatment of a short-term illness or injury that needs urgent attention. Conventional providers are trained to implement specific treatments aimed to treat the immediate problem. This approach just really doesn't allow providers to have the proper tools, training, or mindset to focus on preventative care or really support those with chronic diseases or more complex cases. Conventional medicine also is not set up to be a custom and personalized approach. How is functional medicine different? So how is it different than the conventional medicine approach that we're used to? Functional medicine works to involve the understanding of disease origin, prevention, and treatment. We work to promote vitality, functioning optimally, and thriving, not just absence of disease. Functional medicine providers focus on science-based and integrative approaches by looking further into the complex web that is chronic disease. We work to implement conventional medicine along with some non-conventional approaches. Some of our approaches may be considered alternative or integrative or adjunct. Adjunct means your functional medicine provider may suggest supplements in conjunction with your treatments you're receiving from your primary care specialist. We typically do not stop any of your prescription medications, but we may advise you to discuss weaning off them with your prescribing provider as you make improvements. I mentioned before we utilize vitamins and other nutrients to help support your body. Every system or process in your body requires specific nutrients to do its job, whether that is building tissue, providing energy, or supporting cell membranes. Functional health really focuses on providing your body with those nutrients to help optimize and support each body system. So functional medicine is holistic, individualized, integrative, and biology-based. Holistic, it considers multiple factors like mental health, emotional well-being, nutritional status, and genetic factors. Individualized, it uses targeted treatment and specific lab testing for each client. Integrative, considers the interaction of genes, the environment, and lifestyle factors. Biology-based, focuses on how the body systems interact and function together. Functional health really tries to focus on root causes or the underlying cause, rather than just managing symptoms. We do this by trying to customize plans and make more patient-centered approaches. Functional appointments often allow more time for conversation to allow the provider to understand your unique health history and needs. Providers may use assessment tools to get more information about daily activities, nutrition, sleep patterns, stress levels, family history, and even bowel habits. Typically, recommendations are more based on diet modifications, exercise, stress management, sleep hygiene, and other things that support natural biological processes. If you've had an appointment with me before, you may have seen this image. I often share this picture with clients. I feel this image helps explain what we mean when we say root cause. Diseases and issues with our body are often caused by toxins or stressors that our body gets exposed to throughout life. Life happens, and we are often putting ourselves through emotional and mental stress, lack of sleep, poor diets, and other things that are hard on our body on a daily basis. Over time, these roots grow and develop and make it difficult for our bodies to compensate. That is when a disease develops. It is a lot easier to begin addressing those root causes and supporting the body to deal and recover with these stressors than it is to try to knock out the entire tree or disease all at once. Conventional medicine is really disease-oriented. From a conventional standpoint, we are trained to intervene once a disease is diagnosed. This often involves prescribing medications or getting procedures that come with their own set of risks and possible side effects. Conventional medicine focuses so strongly on the presence of disease, we don't necessarily discuss the absence of disease. This doesn't allow us to focus on preventative care or early detection. It is more of a reactive approach rather than proactive. Conventional medicine is often doctor-centered, meaning your provider tells you to do this and you're expected to follow their recommendations. There isn't always a conversation or opportunity for shared decision-making. Providers don't always take the time to educate and explain why they are making these recommendations and what all your options are. They also don't always take into consideration what may work best for each specific patient or what limitations each patient may have. Conventional medicine has also become very standardized. Much of conventional medicine is based around you have this issue, therefore you need this test. Your test showed this, therefore you need this medication. Most conventional medicine providers' decisions are guided by evidence-based practices. These practices are followed because they are well researched and have proven to have positive outcomes. The issue that these evidence-based practices have led to is healthcare becoming very standardized, making recommendations very one-size-fits-all. And health is not a one-size-fits-all thing. Conventional medicine is often specialized. You have to typically see a different specialist for each body system, making it difficult for every provider to be on the same page and help support each body system to work together. This can also be really confusing for the patient and very time-consuming. Conventional medicine often bases their diagnoses off symptoms. Conventional medicine really doesn't start doing testing or looking for presence of disease until someone starts complaining of a symptom, making early detection very difficult. Symptoms are often a late sign that something is not functioning properly. Health is really a spectrum, with optimal at one end and disease at the other. Obviously, our goal is optimal health. Unfortunately, in the conventional medicine world, we really aren't taught to react until there's a symptom. By the time someone has developed a symptom, we are so far on the opposite end of the spectrum of being healthy, it makes it really difficult to intervene. Utilizing a functional medicine approach, we are able to look at labs closer and catch small changes before they manifest into full-on symptoms. This allows us to make smaller changes over time that really make a big impact. Symptoms can sometimes be difficult to detect quickly because they can present as fatigue, aches and pains, weight gain, depressed mood, hair or skin changes. For example, some of these are easy enough to just kind of blow off as a normal life experience or getting older, when actually it's our body's way of telling us something's going on or it needs something. We've always been taught to not seek medical care until there is an issue. It's not often encouraged to go see your primary care when you're feeling well. We put off our health due to busy lives and we make excuses for how we are feeling. But what if we kind of retrained ourselves to be more proactive rather than reactive with our health? Both conventional and functional labs are obtained the same way. Whether it is blood, stool, urine, or saliva, the biggest difference is the reference ranges used when reviewing the labs. Conventional labs use a wide reference range of what is considered normal, but not necessarily optimal. These wide ranges make it difficult to identify when you're moving away from optimal health. Conventional medicine providers are primarily trained in disease diagnosis and treatment recommendations rather than just optimizing health. Conventional reports often have abnormal labs flagged or bolded, and conventional providers are typically trained to focus on the abnormals, whereas functional reports often aren't flagged, and functional providers are trained to read more in between the lines and look for patterns and trends. Conventional labs are designed to help providers make informed diagnostic decisions and diagnose diseases. Typically, when conventional providers review labs, they are looking at each result in isolation, rather than looking at connections with other labs. Functional labs give us clues about why you may be feeling unwell far before your labs are abnormal. It's important to understand normal and functionally optimal are not the same thing. Optimal ranges are much more narrow. Functional labs allow the provider to get a better idea of dysfunctions, imbalances, and deficiencies, rather than simply diagnosing a disease. Functional labs also look at relationships between results to uncover hidden risk and allows providers to see opportunities to improve your health. Lab work allows us a critical window into your health status and can help reveal hidden trends to allow providers to make personalized recommendations and focus on promoting overall health and wellness and preventing disease. Patients always want to know, are my labs normal? So what even is normal? We assume if we are told our labs are normal, that we are healthy and free of disease, when really these ranges should be called reference intervals. Normal ranges or reference intervals should really only be utilized to help compare. These references are simply averages, the results of where 95% of the population that was tested fell. This is an oversimplified approach to the complex nature that is health. Labs are very much individual, relative, and situational. All factors such as age, gender, prior diagnosed disease, medications, etc., must be considered when reviewing labs. What is normal for one person may not be considered normal for someone else. The idea of using bodily fluids to get an idea of someone's health status is not new. Hippocrates was noted to have done rudimentary testing on bodily fluids as early as 300 BC. The normal ranges we are familiar with were created around 65 years ago, utilizing a small test group of people that were assumed to be healthy. It's unclear if they went on to stay healthy or possibly developed a disease later on in life. These ranges did not necessarily take into account the many factors that can alter what is normal. I'd rather be optimal than normal. Optimal ranges were created by analyzing data from large populations of healthy individuals, identifying the level of a specific lab result that's associated with the lowest risk of disease or best health outcome. Optimal focuses on the best range within the broader normal range, rather than just the average. These optimal ranges were created using extensive research, clinical trials, expert consensus, and considering factors like age, gender, and even ethnicity. These optimal ranges are updated as the newest literature is available. So let's use vitamin D for an example. Less than 25 is considered deficient, and greater than 50 to 125 is considered sufficient in conventional medicine. However, from a functional standpoint, optimal vitamin D is actually 75 to 100. The small range is associated with the lowest risk of death and can help support muscle health, bone health, mood, and immunity. So we briefly discussed the differences between conventional medicine and functional medicine and have discussed the differences between conventional labs and functional labs. But what do functional medicine providers do with those lab results? How do we use that information to help keep you healthy and optimize your health? Unlike conventional medicine, functional health providers try to focus on alternative options besides prescription medications. We utilize supplements and lifestyle changes such as diet, exercise, and mental health practices. I personally really try to focus on changes that can be made and that will easily fit into your lifestyle. For me, it's all about supporting your body so it can handle what you need it to do on a daily basis, whether that's chasing your kids around, staying up late to study for school, training for a marathon, or handle just normal work-life stressors that happen daily. Our functional health program allows clients to get very comprehensive labs done, probably more testing than they've ever had done at one time in their life. We check everything from hormones to liver health to thyroid, electrolytes, and more. In conventional medicine, you're really limited to what you can get tested due to needing insurance's approval. Once you get the labs, one of our providers then analyzes your labs and we do an extensive lab review. We then come up with a custom plan to help meet your goals and support your body to get back in balance. I say extensive because our lab review isn't going to just be, this is normal, this isn't. We're going to explain what each test is, what we're looking at, and why. Lab work really allows us to get a picture of what is going on inside your body and address issues way before you actually feel them. It gets rid of the guessing game and gives us data we can use to help guide recommendations and track progress. I really recommend getting these thorough labs every 6 months to a year. We've talked about the pros of functional health, but I do want to point out possible challenges and considerations. It is a time commitment. The functional medicine approach can take longer than the conventional approach. It often requires commitment and consistency to get desired results. Functional medicine is focused more on getting to the root of the issue and resolving it long term, rather than a short-term fix of covering up symptoms. Functional medicine often requires the patient to make significant lifestyle changes such as diet, exercise, limiting stress. These can be really hard changes to prioritize and implement. Functional medicine is not a substitute for emergency medicine. Functional medicine was never intended to manage acute or urgent issues like a broken bone, heart attack, or stroke. Conventional health definitely has a time and a place, and it's great for diagnosing diseases and dealing with emergency situations. Like if you have a broken bone, taking some vitamins probably isn't going to fix it. It may support the healing process, but you probably need to go see a specialist and you might need a cast or even surgery. Cost can often be a deterrent when looking into the functional health route. Most functional health clinics are private pay, as insurance often does not cover functional services and therapies. Many clinics are beginning to accept HSA and FSA now, which is a step forward. IV Nutrition works really hard to try to work with our clients to decrease the financial burden. Some people view functional medicine recommendations as controversial. A lot of this is related to not understanding the functional approach. I can back this statement as a provider that was initially conventionally trained and worked for 10 plus years in the conventional healthcare world. We are not trained to utilize vitamins and nutrients and to manage chronic diseases long term with vitamins and nutrients. Most of our training is not centered on preventative treatment. Therefore, we are not knowledgeable about these alternative methods. Functional health is also not well researched due to difficulty conducting large-scale studies. Standardized studies are difficult since each recommendation is highly personalized. There's also limited funding to help further research. There are many different types of functional health providers with varying certifications, training, and backgrounds. It can be difficult to know who to trust. Ultimately, you may have to trial out multiple providers to see who's the best fit for you and your needs. Each provider often brings a unique perspective based on their knowledge and experience. Functional medicine can feel very complex. It isn't as simple as take this pill once a day for 7 days and you'll be good to go. It often involves multiple recommendations and multiple follow-ups to help fine-tune what your body needs. One of the hardest barriers to functional medicine is that clients often have to unlearn conventional medicine practices. Functional medicine works differently and follows different rules and regulations compared to conventional medicine. There is a lot of overlap, but functional medicine providers are looking at the body through a different lens and with a different mindset than a conventional provider. Oftentimes, a functional medicine provider has to set clear expectations up front so clients can commit to being successful and understand why certain recommendations are being made. Overall, functional medicine can be beneficial and a legitimate form of healthcare or a great adjunct to conventional medicine, but it is best to ensure you're working with providers that have proper training and experience and understand when it is time to seek conventional care. The future of functional health. Research on functional medicine is growing with increasing focus on gut health, nutrition, and lifestyle factors. Practitioners are starting to bridge the gap between functional and conventional medicine by integrating adjunct therapy with evidence-based practices. As interest expands, new studies aim to uncover the underlying mechanisms driving functional health approaches, enhancing their credibility and application. Functional medicine has been around for a long time, but has always been somewhat controversial for many different reasons. It is now becoming more well-known and is more readily available. More and more conventional medicine providers are looking at ways to integrate functional approaches into their typical standards of care. Unfortunately, there is a gap between emerging science and implementation into medical practice. It can take as long as 50 years before new research is implemented. So you may be wondering how IV nutrition plays a role in functional health. IV nutrition helps provide the resources your body needs to repair and rebuild itself. That's literally the name of one of my favorite IVs we offer, Repair and Rebuild. We help guide our clients in picking what services are going to get them the most benefit. We have oral supplements, injections, and IVs that are all tailored to different focuses to try to optimize what nutrients you're getting. You may also be wondering why we offer IV therapy and not just oral vitamins. We really specialize in our IV and injection services to provide more effective delivery of vitamins and nutrients. Oral supplements are great. You can take them daily and they're convenient, but oral supplements are not all necessarily highly regulated. We do provide oral supplements through IV Nutrition, and they have all been handpicked due to their quality and contents. So just ordering supplements online or from the grocery store does not ensure you're getting high quality nutrients. It's really important to work with a provider to ensure that you get high quality supplements. People are always unsure how much of what nutrient to take. Your gut will really only absorb a certain level of an oral nutrient. So just taking like double what the bottle says isn't necessarily going to get you more of that nutrient. Typically, our gut is not nearly as healthy as we think it is. This can make it difficult for us to break down and absorb oral supplements. IV therapy is 100% bioavailable, meaning it can get directly into your bloodstream and into the cell. This also allows us to custom make our bags so we can adjust nutrient dosing based on your personal needs and our recommendations. If you're interested in learning more about functional health, we will be hosting a webinar each month this year. We will be working our way through each body system, with the next topic being a focus on cardiovascular health. So be watching for information on how to register for that. If you like this webinar, please feel free to share future registration information with friends and family. If you're interested in learning more about how IV nutrition can help you with your health goals and preventative care, please feel free to use this link to schedule a free call with me. I would love to help you find the clinic closest to you, discuss next steps, and get you on the right track. We will make sure to share that link in the chat as well. I've also included my link tree. This includes links so you can follow my social media accounts and continue to receive updates and further education. We will share that link in the chat as well, or you can scan the QR code on the screen with your camera on your phone and it will take you straight to my link tree. I would also like to invite each of you to visit ivnutrition.com after the webinar to check out the services that we offer and take a look at all of our current locations. Thank you so much for attending our webinar. We will now be answering some questions. We will try to answer as many as we can. If your question is not answered, please watch for a follow-up email. This will also include a recording of the webinar and a post-presentation survey.
Sam, thank you for that presentation. I have some questions here I'm going to throw out to you. I know I learned a lot, and I'm someone who works for the organization, and learning more about functional medicine and functional health is really intriguing to me. One question I had is, how does functional medicine incorporate mental and emotional health in the treatment plans? I know it's something that's very big, is everyone's mental health. So kind of walk through what you do to kind of help incorporate that. So it's that really much that holistic approach.
So really incorporating mental health, I think biggest thing is when I do my initial evaluation with clients, try to review all of their health history and talk about, any big life experiences they think are relevant that they want to point out. So really just talking about that, we talk about how stress really impacts a lot of different body functions. So if you have a current stressor that's going on, that can really make a big impact on what your body needs, and what support it needs. But also if you have any, past trauma or chronic things that you're dealing with, we need to kind of address those and make sure we're getting that part of your health supported as well.
You mentioned unlearning old behaviors and habits when it comes to medicine. Like, elaborate on that a little bit about what that means and what some of those habits that people will have to potentially unlearn when it comes to adopting functional health as a way to really help their wellness goals.
Yeah, I think the biggest thing we kind of touched on in the presentation is we have this thing in our head where we don't go to the doctor unless we are sick, unless there's a symptom or an issue or something we're experiencing, something we need help with, we want to address. We even see that with our clients coming to IV nutrition. They're there for a specific goal, whether it's, I want more energy, I want to help with weight loss, I have a cold and I want to try to get over that. We're just so trained to not look for a solution until there's a problem. And so I think that's really the main thing is just untraining ourselves and thinking about what can we do to be more proactive. Like I might feel great right now. I think I am free of disease, but when we think of that health spectrum, where are you at on that spectrum? Are you just healthy? Are you just free of disease? Or are you optimal? And that's really where like lab work can be helpful. It takes that guess out of there. Or we don't, on a regular day, you might not know where your magnesium level is, but if we check your labs, we can tell you exactly where it's at and we can tell you, is it in that optimal range?
When it comes to functional health and getting into a program, a plan, what's the time commitment for something like that? Like, how long does it take to not necessarily see results, but really kind of get to where you want to be and when you're starting to feel the way you're supposed to and want to feel?
So that's really case by case. It just depends on, I guess, what your overall goal is and kind of where you're at on that spectrum we talked about. Um, my my initial approach, I try to stick with like a 6 week to 12 week recommendation. Really, 12 weeks if it's a chronic issue, and then 6 weeks if it's kind of more of an acute short term thing. Um, but that's really just a starting place. That's a great way to see, are we making improvements? How are you feeling? What do we need to change? I think the main thing to think about is if you've had, like, let's say you've had this diagnosis of a chronic illness, diabetes, whatever, for like 3 years. And it typically takes about a third of that time to really make that improvement. So like if you've had it for 3 years, we're probably going to have to aggressively address it for about a year before we can really make a huge impact in undoing that damage. Now, the hope is after about 12 weeks, you start seeing improvement and you feel better. So then we can maybe back off on the frequency of some of the things we're doing.
Yeah, we had a question here too about some examples of treatment plans. I know they're very much personalized, but okay, what would a typical plan be if someone did come in for like diabetes or if they
Mhm.
were needing some kind of chronic pain, Crohn's disease or something like that?
Yeah. So, like you said, very personalized. And that's where labs can be really helpful. Um, you know, if we're just basing your recommendations off of a symptom. So if you came in and said like I'm having chronic pain related to GI issues, well, we can kind of make some guesses on what we should do for, GI related pain. But I think it's also still important to think, what kind of pain? Is it like bloating after eating? Is it like a sharp pain somewhere in your stomach? Different, the way the pain feels can really indicate different issues. And so, what does that recommendation look like? It really just depends on what we think is causing the pain. And back to, if we're just kind of going off of a symptom, um, that may not be the right recommendation. Um, we see people a lot of times they'll come in with weight loss issues, like they're not losing weight the way they want to lose, or like maybe headaches is another good example. And so we start trying to address the like common causes of what slows down weight loss or what causes headaches. But then we do their labs and we really uncover, oh, it's because your liver needed more support, your hormones were out of balance, your thyroid, like there's more of a root cause rather than just addressing that symptom. I know that I didn't really necessarily give an example of a protocol, but um, it's just they're just so custom. It's hard to say. Um, I do find a lot of root causes kind of come back to inflammation, and so we really with inflammation we really try to focus hard on like vitamin C. Whether you go once a week or twice a week just really depends on what your time allows. And then supporting the liver and kind of that detox process.
Yeah, well, I mean, you mentioned it too, that the personalization, and I think something that strikes me about functional medicine, functional health that I like is it's not just looking at what your ranges are in a lab, but what is optimal. So like when you say optimal, like what do you do when you say that, and what is it? How do you go into identifying that with a client?
So optimal is this much more narrow range within what is considered normal. So that optimal range really was designed based on what number or what range is connected to the lowest risk of developing ongoing disease. What number best supports the body system? So, like the vitamin D example we gave, that range was studied and determined to be the best range, not just normal, but like the most optimal, where your body is like the happiest functioning to help support bone function, muscle function, and mood.
So, oh no. And one other question we had that came through the chat is, how do you work with someone's primary care physician or conventional physician? Because I feel like there might be a misconception that there's butting heads, but I don't think there really is. It's probably more of in conjunction with them to give the best results for the client.
Yeah, I would say that's probably provider by provider basis, but I'm really open to working with people's primary care specialists in whatever way their provider is open, whether that's email, phone call. You know, if you, we kind of leave it up to our clients. We recommend that you notify your primary or specialist that you're receiving any kind of alternative type therapy, but you don't have to. It's your body, it's your choice. You get to decide if you want to let them know. It's just good to sometimes keep everybody in the loop. So with that, if your provider is pushing back or has any questions or resistance for any reason, um, I would I personally would love to chat with them. Like I said, via email, phone call, whatever it is, just to make sure we're on the same page. They want you healthy, I want you healthy. So it's really I whatever we can do to work together to get that common goal. I'm not going against what they're saying, and I don't want them to feel like what I'm doing is going against what your primary or specialist recommendations were.
And something that I think is pretty interesting about what you can do with functional health in general is you mentioned earlier about people coming in when they feel bad. What can people do to make this part of maybe their daily routine or health routine and not wait until they're dealing with Crohn's, diabetes, chronic inflammation, or something like that?
Yeah. So I mean, most people are deficient in many different nutrients. I would say from the lab reviews I've done, almost everyone is low in vitamin D. Almost everyone is low in magnesium. Um, we can all probably use more hydration. There's just so many basic vitamins and nutrients that we are deficient in, whether it's from not getting enough in our diet or just depleting it going through our normal daily life. So I think kind of if you were just like, I want to implement this easy, I don't want to like commit to a protocol or regimen or anything like that. Um, Coming in at least, honestly, at least once a month. Once a week is like ideal. You'll benefit significantly, but like once a month and getting, I really like to suggest our Mega Myers bag. It's like a multivitamin in a bag. So getting that like once a month, whether you have an issue going on or not, you just are like, I feel good. I just want to stay on top of my health. Um, I think starting with that would be really beneficial for you. You can also trial getting the Simply Sunshine. That's our vitamin D injection once a month. Because, like I said, most people are deficient in the vitamin D. We don't get enough of it. We're not outside enough. We don't get enough sunshine. So making sure you're really supporting that and getting that level where it needs to be. Those would be really easy ways to just kind of make it a part of your lifestyle. If you're somebody that likes being healthy, you dedicate time to work out, you dedicate time to eat healthy. This can be just one of those other things that you dedicate going like once a month to make sure that you're kind of just supporting what your body needs.
Yeah, I mean, kind of something you mentioned earlier with the mental health aspect of it. It's like mental health. You got to
Yeah.
put in the work for it. You got to put in the work if you want your functional health plan, functional health medicine to work the way you want to, and for your body to operate the way it wants to. We don't have any more questions, and we're at 42 passed. And so I think we're good on our end. I want to thank you again, Samantha, for everything you did and making it easy for me to get some questions from some people. I know I learned a
No
lot.
problem. I was gonna look really quick and just make sure. Yeah, looks like looks like we got them all answered. Perfect. Um, we will make sure to share the link for my link tree and for if you are interested in setting up a free call, like I said, you can follow that link. We'll make sure that's in the chat box as well. You can set up for a free call. We do it via Zoom and just talk about, we'll help you figure out which clinic is closest to you. Also figure out what labs would be the best for you to start with, and also make some basic recommendations on what services may be kind of the best place for you to start while we're waiting on labs to come back. Is
Yeah.
there any other questions before we're all done?
I was just going to say to remind everyone, February 4th is our next webinar. We're
Mhm.
going to start doing them the first Tuesday of the month with the holidays and everything. We did a little later this month. And I believe it's cardiovascular health is what we're doing it on next month.
Yep.
So look for the emails coming out for us to register for that, probably start maybe into this week, early next week. And I hope to see everyone there for it.
And just a reminder, you'll get a follow-up email with a post webinar review just to let us know how we did, what we can do better next time, and also the recording of this webinar if you want to share it with somebody or you weren't able to stay for the whole thing. So, well, we look forward to see you guys next month, talk about cardiovascular health and celebrate Heart Month. And please reach out if you have any questions. Thank you. Bye.